Here's a list of my courses, and let's choose the course talking about the USMLE cases and quizzes. And let's scroll down the cases and choose, for example, this one. Some random hotel had multiple residents all experiencing the same symptoms at the same time. They all had fever with productive cough, so typical for pneumonia. However, some patients also experienced abdominal pain and diarrhea. The hotel recently received their annual maintenance and equipment check, and new equipment have been installed. Keep in mind that the company that installed this equipment and did the maintenance is a foreign company, and most of their workers recently came from overseas. And the question asks, how does the infection spread? So let's look at the key features. We have a hotel residence, so they all share the same hotel water and air systems. We have fever with productive cough, like we said, consistent with pneumonia, and some patients experience GI symptoms. This is very consistent with Legionella infection. Legionella infection infects the water and air sources in a closed environment, like a hotel or a prison. And Legionella does not transmit from human to human. So the only possible way of transmission is from the infected source. The hallmark is pneumonia with either GI symptoms or neurological symptoms. And as you can see, the guideline indicates that there is no human-to-human transmission and only transmission from infected sources. So if we go back to the question, we can see infected water sources is one of the answers, and of course that's the right answer. Another way that the question might present is that they might have the same scenario, but they would ask about the treatment of the infection. And as we know, Legionella is treated with fluoroquinolones, like levofloxacin, and some mild cases can also be treated with macrolides, like azithromycin. Use the link below to get access to the full course, including many cases and hundreds of quizzes. Everything in the course is high yield and common topics that we see frequently in the exams. Basically, we sat down and looked through a large number of question banks, quizzes, and many repeated exams. The topics we've chosen for this course are the most repeated topics, so they are very, very common. Thank you for watching.